Years ago, when I was in training, I would treat a lot of overactive bladder patients, and there just weren't that many good treatments at that time. So we saw lots of women that suffered from overactive bladder, symptoms of urgency and frequency, and then leaking with urge, can't get to the bathroom in time. But the medicines were not great. They had a lot of side effects. They get expensive, so they weren't ideal. And then the best treatment was for only for people with really severe incontinence, and it required an implant in the spine, like a sacral spine, stimulator. But that's pretty onerous, to have a battery implant. And it's kind of involved. And, 10 plus years ago, folks really weren't that excited about, my patients would say like being bionic, having a bionic bladder. They didn't really want to take that step unless their symptoms were terrible. And so we would have just the majority of patients with overactive bladder just lived with it because the treatments were either not great or they just didn't want to take that next step. They didn't think their symptoms were bad enough for the implant. So we would just see so many people that were untreated or undertreated for overactive bladder and living with it.